I said it's a month of endometriosis. Now, let's talk about this. Endometriosis and IVF. In this situation, does it reduce your chances of pregnancy? Does endometriosis affect your chances of conceiving naturally? At Joburg Fertility Center, we are dedicated to turning dreams of parenthood into reality. As leaders in the advanced reproductive care, we provide cutting-edge fertility treatment tailored to each patient's journey. Whether you are exploring IVF, IUI, egg donation, donor cycle IVF, or even fertility preservation, our team of experts is here to support you every step of the way. In today's video, we are discussing a very important topic: endometriosis and in vitro fertilization, or ART. Whether endometriosis reduces your chances of success with IVF or not, many parents diagnosed with endometriosis worry that they will never fall pregnant. The good news is that is not true. The relationship between endometriosis and IVF is a very complex one. And today I will explain it clearly and scientifically. Endometriosis can make it very challenging to conceive, especially when it comes to IVF. The condition can negatively impact various stages of IVF process, making conception more difficult. For instance, endometriosis can lead to severe inflammation, scarring, and adhesions in the pelvic area, which can make it harder for the embryo to implant. This can result in lower success rate for women with endometriosis undergoing IVF. It commonly affects the ovary, endometrioma, the fallopian tube, obstruction, the pelvic lining, poor receptivity. In severe cases, it can form an ovarian cyst called endometrioma. Approximately 30 to 50% of women with endometriosis may experience difficulty in conceiving. How does endometriosis impact IVF? Endometriosis can interfere with IVF in several ways. It can affect the egg quality, making it more difficult to retrieve healthy eggs for fertilization. Uterine receptivity can also be impacted, making it harder for the embryo to implant. Additionally, endometriosis can affect embryo implantation itself, reducing the chances of successful pregnancy. The type and severity of endometriosis can also play a role, like peritoneal, ovarian, and deep infiltrating endometriosis can have different impact on IVF success. However, there are three main mechanisms in which endometriosis impact IVF treatment. One, ovarian reserve reduction. Endometriomas can damage the ovarian tissue. Surgery to remove them may also reduce ovarian reserve, especially AMH level. Endometriosis can also affect egg quality. Endometriosis causes chronic inflammation, inflammatory cytokines, and oxidative stress that affect the egg development and embryo quality. 3. Implantation problem. The endometrium, which is in the uterine cavity, may become less receptive due to progesterone resistance, inflammatory changes, and alteration of gene expression due to endometriosis. And in some cases, implantation may be slightly impaired. Does endometriosis reduce IVF success? Yes, major studies show that women with mild endometriosis often have IVF success rate similar to women with moderate to severe disease. These women with severe endometriosis usually produce fewer eggs. However, and this is very important, IVF bypass damaged fallopian tubes and pelvic adhesions because fertilization happens in the laboratory. Therefore, the fallopian tube don't play any part, even if they are damaged, scarred, or blocked. And pelvic adhesion, which distorted the anatomy of the pelvis, is also taken away because IVF happened in the lab. Therefore, those have no impact in that situation. So, IVF remains the most effective treatment for infertility associated with endometriosis. The main issue is usually ovarian response, not fertilization. How do we optimize IVF success in these patients with endometriosis? Evidence-based strategies include: 1. Individualized stimulation protocol. 2. EMH guided medication dosing. 3. Avoiding unnecessary ovarian surgery. 4. Consider GnRH downregulation in severe cases. Freeze all cycle when needed. And lastly, we recommend PGTA in selected age groups. Then, with proper planning, many women with endometriosis achieve excellent pregnancy outcome. Endometriosis does not mean infertility. It does not mean IVF will fail. In minimal or mild disease, IVF success rates are very close to normal. In severe cases, endometriosis, ovarian response may be reduced, but pregnancy is still very achievable. Now, here are the key factors to get success in IVF with endometriosis. Proper evaluation plays a major role. Secondly, evidence-based treatment. And thirdly, individualized planning. If you have endometriosis and struggling to conceive, do not lose hope at all. Modern reproductive medicine offer very effective solutions. Thank you for watching this video. Please like, comment, share the video, subscribe to our channel to see more women health issues discussed, fertility issues, pregnancy videos, and all reproductive health issues and advanced modality of treatment of certain conditions, new treatment regimes, and so forth. See you on next videos.